I did my presentation on racial discrimination in healthcare. So identifying the problem, I said no access to healthcare is a major problem in today's society. There are many issues that lie under this topic. However, I'm going to be focusing on the racial discrimination in healthcare. So first off, I said members of racial and ethnic minority groups have historically faced health disparities in the United States, and the COVID-19 pandemic has ruthlessly worsened many of these disparities. As of November 2021, American Indian and Alaska Native, Black, and Latino individuals all have greater rates of hospitalizations and deaths due to COVID-19 than white people. These disparities stem in large part from racial and ethnic minority populations' unequal access to care, which persists due to structural racism and healthcare policy. Just another slide to add on to this. Identifying the problem, also the tendency to unintentionally link categories or group members like persons of color or those who identify as Black, and a negative assessment is known as implicit bias. And then adding onto that, in the landmark Unequal Treatment report from the Institute of Medicine published in 2003, a group of doctors, behavioral scientists, public health specialists, and other health care experts came to the conclusion that even after accounting for access to care barriers like income and insurance, racial and ethnic minorities still received inferior health care to that of white people. Why are certain groups of patients getting different care? Doctors take an oath to treat all patients equally, and yet not all patients are treated equally well. The answer to why is complicated. Cases like my patients above illustrate the negative assumptions and associations we can label racism, but most physicians are not explicitly racist and are committed to treating all patients equally. However, they operate in an inherently racist system. We know that our own subconscious prejudices, all called implicit bias, can affect the way we treat patients. Basically, there are so many layers and levels to do this issue, it's hard to wrap our head around it, but we'll try. For the ethical issue, I said discrimination is detrimental and keeps inequality alive, regardless of our race, ethnicity, nationality, class, caste, religion, belief, sex, gender, language, sexual orientation, gender identity, or sex characteristics, age, health, or any other status. We all have the right to be treated equally. Individuals' opportunities, well-being, and feeling of agency are all impacted by discrimination. Individuals who are subjected to discrimination on a regular basis may internalize the stigma or prejudice that is held against them, which can lead to poor health, low self-esteem, fear, and stress, as well as shame. Other ethical issues. Racism's primary ethical failing is that it is inherently demeaning to a particular set of people. Racism is defined as a lack of respect for the dignity and circumstances of a particular group. The fairness of racism is another moral failing. A well-functioning liberty society must prohibit discrimination on the basis of race and ethnicity, as it is a fundamental defect. Regardless of underlying beliefs and attitudes, racism is an ethically wrong phenomenon because it hurts people who are subjected to it. The options, healthcare providers, according to campaigners, need to publicly identify how racism and race affect patient care in order to reduce these inequalities. This issue of transforming care provides case studies of health systems that are attempting to detect implicit bias and structural racism with their organizations and establishing tailored strategies for patient engagement and support to lessen their effects. Also, if health professionals and professional groups share this viewpoint, they can take the lead in promoting initiatives to lessen these disparities. Good empirical data that can untangle the multiple causes of racial disparities are essential to this situation. Ethics can be used to support the necessity for social action, but in order to know exactly how to intervene effectively, ethics and facts must also be combined. So taking a stand and acting upon it, strategies for combating racism in healthcare, examining institutional policies with an equity lens, establishing accountability frameworks such as equity scorecards, auditing medical school curricula for erroneous references to race, reviewing clinical algorithms that rely on race, investing in scholarships for students of color interested in health professions, training leadership and staff in diversity, equity, inclusion, and anti-racism principles, creating real-time reporting initiatives to track and respond to racist or other discriminatory behavior, reviewing vendor relationships to support Black and other minority-owned businesses, creating more equitable workplaces, including efforts to build wealth and opportunity for advancement, and listening to and learning from patients and healthcare professionals of color. Another slide to add on to this, raising public and provider awareness of the racial/ethnic disparities in care, expanding health insurance coverage, improving the capacity and number of providers in underserved communities, and increasing the knowledge based on causes and interventions to reduce disparities. How can we act upon this? The American Academy of Family Physicians recommends that all healthcare systems, hospitals, clinics, and institutions adopt anti-racist policies that advocate for individual conduct, practices, and policies that promote inclusiveness, interdependence, acknowledgement, and respect for racial and ethnic differences. Also, this academy also recommends that organizations take an active approach to dismantling racism by conducting a comprehensive, critical examination of policies and procedures, empowering the development of diverse formal and informal leadership at all levels, and developing a plan that increases accountability, demonstrates transparency, and reorganizes power. And then my conclusion, the moment has come to end structural racism in healthcare practices that sustain unequal access to high-quality healthcare. If not, the racial and ethnic injustices that have persisted during the COVID-19 epidemic, which only affect the entire nation, but especially minority groups, will continue. However, this change won't occur unless system reformers intentionally and persistently focus on addressing inequities in order to make health equity the standard. And then I just have all of my works cited. That's all. Thank you.